This is tick season, so typically we look to May through even September as being prime time for ticks, tick-borne diseases. And that's not only Lyme's, but that's a whole array of tick-borne diseases such as babesiosis and ehrlichiosis and other as yet unnamed tick-borne diseases. I would say that Lyme's disease is a very interesting disease in that it requires two vectors, and what I mean by that is you have to have a mammalian population such as rodents or mice or deer that carry the tick, and then you have to have the tick, which is called Ixodes scapularis, that carries the parasite. What happens typically is the tick will be deposited on human skin, and sometimes takes up to 24 to 48 hours to actually bite, settle in and bite. And during that time, then the parasite is transferred into the skin. I always break it down into early disease, early Lyme's disease, early localized or regionalized disease. Early local disease would be typically a rash, what we call an erythema migrans rash, red rash with a central area that's cleared. If I see that, I'll treat for Lyme's. We don't need a blood test. Typically that skin lesion will appear before a person would seroconvert with being positive in blood tests. And then there's early disseminated disease, and that would be multiple of those spots over the system throughout the whole body, multiple erythema migrans rashes, and maybe sometimes even what's called Bell's palsy, where the mouth would drop a little bit. And sometimes even people can get heart block or diseases that affect the heart. And then finally, Lyme's disease, there's a late component to that as well, and that's usually, it involves the large joints such as the knees, sometimes the hips, and that can take sometimes months to years. So it's an interesting disease in that Lyme's disease is always thought of in Jackson County, especially when people have some non-specific complaints, fatigue, maybe headaches, joint aches, those kind of things as well. Actually, if one of those erythema migrans rashes appear, that's enough to make the diagnosis. If we get a blood test, we have a rapid screen, and if that's positive, then we send off a it's called a Western blot test, and that tells us if it's a recent infection. You can, of course, get reinfected with difficult because we live in a very endemic area. We get the disease a lot, but certainly if you're out in the woods wearing long sleeve shirts, I say lighter colored because you can pick the ticks out easier. Also long pants. I also recommend that socks be rolled up over the pants. Also, I recommend if you're really going into a highly infested area to put DEET on the shirt and on the pants, and on skin. I usually recommend Skin So Soft, which is kind of a protective barrier that for some reason the ticks hate that. Either it's the scent or whatever, they just don't like that. And to sort of put that around the neck, around the ears, wear a baseball cap. Then I also recommend doing body checks when you come in from, a hike or whatever, and making sure that no ticks are there. Without a bite, remember that usually 24 to 48 hours, the tick will be exploring you or us and wandering around the body trying to find a warm area to kind of burrow in. So if you remove a tick, I don't see a problem. If the tick has actually made a bite, then there's some literature, I think, out of one of the hospitals back east that says that maybe even treatment with doxycycline for 1 day, 100 milligrams twice a day, can decrease your chance of Lyme's disease after a bite. The medicines that we have, doxycycline, and for allergic patients, amoxicillin and others, these are very good. Again, you can get this post-Lyme's syndrome, but generally cure is very very readily obtained. The clue is being aware that we live in an endemic area. Be aware that if you do get a bite, sometimes your physician would recommend, especially if there's a reddened area, getting doxycycline for 1 day. And then realizing that there's a lot of preventative measures